Baby first aid. When a baby is experiencing a medical crisis, it is important to provide care and seek help as quickly as possible. Delivering first aid to a baby is different than administering care to an adult because an infant's body is different from an adult's body. A baby's body has soft bones, a big head, a big tongue, small lungs, and thus a small breathing volume, a well-developed heart in comparison to the rest of the body. These characteristics will affect the pace and placement of the chest compressions, the form of the rescue breaths, and more. Now let's learn how to perform CPR on a baby. Stage number 1 is safety. Make sure the scene is safe for the baby and for you, the caregiver. Then check if the baby is unresponsive. Talk to the baby and gently pinch the bottom of his foot to elicit a response. Then call for help. Ask a bystander to call for professional help. If you are alone with an infant, administer 1 minute of care, then call for professional help. Next, open the airway. With the baby lying on his back, put a hand under the baby's shoulder blades, allowing the head to tilt back to open the airway. Then check for breathing. Listen carefully for sounds of breathing. Look at the chest and try to feel the breath on your cheek for no more than 10 seconds. Occasional gasps aren't breathing. If the baby shows signs of choking, perform Heimless maneuver. Note that the Heimless maneuver for a toddler is very different than for an adult. Signs that can help you understand if the baby is choking: violent coughing, being unable to cough, speak, cry, or breathe, a high-pitched sound while breathing in, a pale or blue-tinted face, the child is clutching at their throat. How do you perform the Heimless maneuver on a child? Lift the baby like this and slightly tilt it forward while supporting the head. Give the baby 5 back blows with your free hand. Be sure to give the blows directly between the shoulder blades with the heel of your hand. Roll the baby on your other arm, supporting its head and neck. Then give 5 chest compressions while still holding the baby in your arms. We will learn how to perform chest compressions on a baby later in this video. Continue to provide cycles of 5 back blows and 5 chest compressions until the baby stops choking or is not breathing. If the baby is not breathing, lay it on a hard surface and begin CPR. If the baby is breathing, hold him on his side with his head slightly tilted back, supported and lower than his bottom. Holding the infant like that will help keep his airway open and ensure any fluids drain out, and this will help the baby continue breathing. If the baby is not breathing, begin CPR. Perform cycles of 30 chest compressions followed by 2 rescue breaths. Start with 30 chest compressions. Lay the baby on a hard surface. Put one hand under the baby's shoulder blades. Place your other hand in the middle of the baby's chest, 2 fingers below the nipple line. Use 2 fingers to push firmly. The chest should go inward about 3 centimeters. Make sure to release the pressure, allowing the chest to come back up before pressing down again. The press and release time should be equal. The angle of compressions should be 90 degrees to the infant's chest. The compression rate should be 120 pumps per minute. This is rather fast. After 30 compressions, open the airway and give 2 rescue breaths. To open the airway, look into the baby's mouth and check for fluids or secretions. If there are secretions, lift the baby like this. Make sure to support the head and keep it straight to avoid spinal cord injury. Then remove the secretions with your finger. Give 2 rescue breaths. Put your hand under the baby's shoulder blades to tilt the head back. Use your mouth to make a complete seal over the infant's mouth and nose. Then blow in for no longer than 1 second to make the chest clearly rise. Release the infant's mouth and nose between the puffs. Note that, according to the American Heart Association, a passerby doesn't have to give rescue breaths. Continue with cycles of 30 chest compressions followed by 2 rescue breaths until professional help arrives.